This conference will now be recorded.
Okay, stop.
Okay. Hello, I'm Dr. Marwa, one of the doctor covering the clinic today. May I confirm your name and age, please?
Yeah, I'm Sarah and I'm 28.
Okay, ma'am. Can you bring first slide, please?
Sure. Go on.
Okay. Is it okay to call you Sarah?
Yes, it's fine.
Okay. Sarah, I see that you came for your booking visit today. Am I right?
No, doctor. Actually, I have done my tests, etc. The midwife just wished that I should see you about certain concerns. So that's why I'm here.
Okay. Did you attend any antenatal visit before this visit?
Yeah, I have been seeing with the midwife, and she has also arranged like these tests for me. And some of them have been done. My scan also has been done last week.
And how is your pregnancy so far, Sarah?
So far, it's okay. It's fine, not having any much issue.
Okay. What is your concern and the expectation from our meeting today? Is there any specific concern?
No, see, doctor, the thing is that, as midwife might have mentioned, the thing is that I am on methadone for I've been using substances on and off. It's always been a problem. And the thing is that now I'm continuing to use that medication slightly better. But I did mention to her that I have, uh, required to use still heroin intermittently as well. I need it. I get the urges to use again. So I think she was worried about that. And again, I'm also quite kind of worried about what effects it will have on my baby in my pregnancy and how my care will be in the near pregnancy, etc. So I
Uh,
wanted to understand more about that.
Okay, Sarah, I will address all of your concern. I am here to help you and support you. Don't worry. Do you have, apart from this concern, do you have any other problem facing during pregnancy? Do you have any excessive nausea or vomiting?
No, I don't have any other thing.
Any lower abdominal pain?
Not really, no.
Okay, and is there any abnormal discharge from down below?
No.
Okay. Can you tell me more about this history that you use? Did you use any intravenous drug?
Yes, like I mentioned, heroin. And I've been, like, I tried to, but avoid it now. But, intermittently I have used in pregnancy as well.
I see. And apart from that, do you have any other smoking or alcohol intake?
No, I don't smoke. I don't drink
Oh,
also.
okay. And are you aware about your weight height ratio?
24.
Okay. And apart from that, do you have any other medical or surgical condition before?
No.
Okay, okay. Do you have any family history of cholesterol, leg or lung?
No, I don't have any problem.
Any personal history of the same?
No.
Okay. Sora, did you have been treated for any sexually transmitted disease before?
No.
Okay. Sora, I wanted to reassure you whatever we have discussing here today is absolutely confidential between me and you. Nobody can know about this. So feel free to talk about anything. Okay. How is your partner support? Are you in a stable relationship?
I'm living with my current boyfriend, and yeah, I am, kind of dependent on him. But yeah, that's what it is.
Okay, and how's your family support, financial support?
I'm basically by myself, and since I'm not really earning, I'm financially dependent on him
Mhm,
entirely.
mhm, mhm. Okay. Coming to your concern, is it okay to examine you in the presence of Shabran Sarah to check for your vitals, blood pressure, check for your
Yes, it's
abdomen?
fine. It's fine, yes.
Okay. Do you want to add anything else prior to discuss about your concern?
No, it's that's it. That's what I want to know about.
Okay. Sarah, coming to your, you have done with the blood test for the booking visit. You have done with the scan. So I have confirmed your name and the NHS number on this scan and the blood result, and it came that everything is normal and quietly reassuring. But regarding your history that you give about the opioid misuse and the methadone that you are on, it is a good thing that you started on this medication because it can help you to avoid certain complications that could happen to the baby during your follow-up for this pregnancy. Like baby can be small, can have early delivery prior to its gestational age due date, and it can also lead to separation of the placenta early and bleeding in pregnancy. This all can prevented by this substitution therapy methadone that you are on. I am encouraging you to continue on the same. And did you see your addiction services specialist near to this visit?
Not anytime recently. I think that's one of the reasons I'm here as well.
Okay. So I will refer you again to be seen by this specialist. And your pregnancy actually will be a high risk pregnancy. So the community midwife was referred you to here because you should be followed in consultant-led care with a multidisciplinary team of doctor, including the consultant and also the addiction services specialist, the prenatal mental health, and also you will be regularly follow up with also dental hygiene to check for your any dental problem. We check also you have done by certain can can I see the investigation in the second slide?
Just a minute. Can you see it?
Yes. Okay, you have done with the, all viral screening and it came negative, which is quietly reassuring. But if you still use it as this IV drug, we can test again after 3 months to check for any seroconversion for the same. And Also, we should have to check regularly for the growth of the baby from 28 weeks regularly to have a regular visit, frequent visits, as well that methadone that you are taking, it's quietly a safe medication, but actually you should follow the addiction service for the dose to avoid any excessive dose from this medication. And also it can affect the baby after delivery, what we call the neonatal abstinence syndrome. Baby can have excessive crying, cramping, even seizure. At this time we will review the baby with the neonatologist for this condition, and no early discharge, at least 70-hour baby will be stay in the hospital to monitor for this. About 32 weeks, we have a conference meeting with this pre-birth team. They will review your case. They will include all the team, as I have mentioned, and along with the GP and health visitors and the specialist nurse. All they will take care of you, and social services can be actually involved in your case. If you feel you need any financial support, you can also give you the same. I'm a case of our Sarah.
Yes.
Okay. Sarah, if your pregnancy is going normal and everything is reassuring quietly, you can deliver with your midwife and midwifery care. And also, after delivery, baby will be monitored for the same. And you will given this medication during labor will be also given. Methadone will be given. And if you need for any increasing of your analgesia, like also we can give you certain high doses or epidural in labor. This all can help you. Breastfeeding, you can breastfeed while you are in this medication. It is safely to breastfeed with the baby, but actually. But actually, if you are taking heroin, it can lead to respiratory depression of the baby, so affect the breathing of the baby. So we are not advised to breastfeeding while you are taking this IV heroin. Okay.
Okay, time is up. Time is up. All right. Okay. All right. Yes, Dr. Mahmood, how do you think it went?
I don't know. I have actually I have take time to check her investigation again because I will check for hepatitis C done or no, and
Hmm.
yeah, because she told she is IV user of the drug. I also
Hmm.
was planning to give her some prophylaxis, but it was actually going without. I was planning to tell her about the contraception and this one thromboprophylaxis,
Hmm.
but it was like because we took some time also to change the slide to see here and there. It went prior to finish these instructions. Uh, this all again.
Okay. Okay. Do
Yes.
you think that any task which comes up in the exams would be about one particular agenda and only that agenda, knowing that how the college is structuring the questions these days? All right. In this
No,
situation,
maybe
yeah.
she has maybe hidden agenda, but she didn't open up because I have assured her confidentiality. I have told her also about financial support and so social support.
Mhm.
She's also still. I asked her about a partner because might be she has domestic violence or abuse, but she didn't open.
Mhm. But phrasing the question brazenly about uh, can you tell me more about your partner is not going to do it for you. You need to ask if you are suspecting in these kind of situations specifically that violence may be a component. Okay. Now, when you look at this task, there is a lot of information already presented to you, which is that she has come at 20 weeks of gestation. Now she was referred from the midwife after this 20 weeks of gestation with her investigations. Okay, so some investigations that have been done by the midwife to you. So that is one thing. Secondly, you have to understand that since a lot of the information is given, for example, associated medical, surgical comorbidities is nil, they might give this in this fashion or in the form of a referral letter. They might give you a lot of data about the patient. That means that usually they don't expect you to repeat that information gathering again when you are asking questions. All right? Hmm?
Yeah, yes, ma'am. Yes, I have don't
Okay.
ask. I didn't ask her about
Hmm.
this one because I was not seeing this slide again. So I have asked
Okay.
some questions. Then I
Yeah.
realized already it is there. So I
It's
omit the
there.
other question.
Right.
Yeah.
So some of the things they are given on purpose to you. So you have to know that it is to facilitate that you can take your information gathering more quickly. And usually in these tasks, there this is complex social factors, one of them, right? So other factors which are there in complex social factors, can you name them? They become much more important in terms of information gathering, marking domain here. All right.
Yes, ma'am.
Rather, you sticking to your typical pattern of taking your history. So, can you
Yes,
name them?
she need to. I need to know about her support, her work,
Mm.
her partner, and the family support, and domestic violence,
Domestic violence,
sexual
right?
abuse,
Yes, yes. And
and what
what
else?
else is it?
Uh,
Prone to? They are prone to other things as well.
yeah, sexual abuse and domestic abuse and
Mental health issues.
mental
So
health.
they
Yeah,
may
mental
be
health.
having concomitantly
Depression.
suffering anxiety, depression, and other psychological disorders also, which may predispose her to having this substance abuse. Note the individual is 28-year-old and she is gravida to para 1. So what happened to the first one?
Yes.
She's gravida to para 1, right? Let me share that slide with you. one second. Little bit of lag here. Yes. So G2P1, right?
We should
Hmm?
also ask here about that. Yeah.
Additionally, see, a lot of the things are because the methadone itself is not a hidden agenda here. So you know that this is about when you're entering this task, a good candidate is looking at the information given here and knows that
Oh,
this is
yes.
about somebody who is already a drug abuser, already gone to de-addiction centers, already put on replacement therapy. So that
Mm,
is executed right now. So, what may be missing in terms of like information gathering? Medical surgical comorbidities already mentioned.
yes.
Investigations, everything is given to you. So
Mental health.
you're not advising with regards to those things, but you are thinking, okay, there can be other complex social factors here which will have more weightage for your information gathering. Okay, so you will have recent current substance abuse, which is adherence to the methadone. Are you taking this thing regularly? And have you, if she had not opened up about the relapses or use of drug, then you have to specifically ask. And rather than using the word drug, you should say substance, which was a very good thing that you did. Okay, so you didn't say use the word drug abuse, or substance use is a better lay terminology, so that they don't feel much offended by the use of that word. Okay, so that was one
Okay.
very good thing which I noticed in your task as well. About physical health, fetal movements, etc. Now, asking her about discharge, etc. may not really. Were you looking in terms of like signs and symptoms of STI? Is that the reason you were asking that? Or what was there? Or just in general?
No, because the drug, she is also prone to have sexually transmitted disease.
She's prone
So I
to,
don't.
but yes, a couple of those things are given to you. In fact, I would advise rather than saying the confidentiality in a later half of this station, it should have started with this,
Yes, yes,
because you
yes.
know that here it is likely she'll be very reluctant to give you information unless you reassure her about confidentiality and the fact that you know you're signposting that you may have a lot of personal questions here. So it is not a must that needs to be stuck only with sexual reproductive health tasks or subfertility tasks, as we usually say. But in situations like and these kind of antenatal tasks, okay, you can or you must, in fact it's a good habit to do that in the beginning, because it will differentiate you from a um, average candidate to a better communicator who is more sort of reassuring and professional, right? So you should do that in the beginning and
Ma'am,
then start asking her
if I
later.
have asked her from the start about her concern, is it she can open from the start, or because of
Depends
hidden
on her,
agenda
what her script is
she will
saying.
not, she will not.
Depends on what her script is saying. I will tell you the reason why it is quite obvious that she will talk about the drug abuse is because the main task itself is telling you that it is about somebody who's on drugs and using methadone, right? So that's not something which is hidden. It's information already obvious to the candidate. So why would they write it in a manner which is like in the script where they would hide a particular thing about the drug use? It's quite obvious that she would tell you about her habit, because
Yes,
that is the main reason why she's meeting you. It is given to you in your question. Okay, it's given to you in your question. It is unlikely to be a agenda, all right? But yes, you have to be aware that in these situations there can be other associated things which may or may not be there, but you cannot get away without inquiring about it. Okay, and it may be just not like a main aspect in terms of patient safety, but what it will do is it will affect your global scoring if you have not explored that particular thing. If you didn't ask her about these, as she mentioned, she is completely financially dependent on the partner. She's not currently employed or earning in any manner, right? Okay,
yes.
so it becomes very important to also understand the social situation in a little bit more depth, which I expected you to ask here, because we don't have the other aspects of information gathering here. Like those questions you can dump, but it becomes more important to ask living conditions, which you did, but you should have got that hint that there may be something here, as she's saying, I am financially entirely dependent on this particular person. So one is to understand how her relation with the partner is, any form of violence or abuse that she's
Yes.
facing, and secondly, also about the partner, if they are also in the habit of using, okay, substance, then it becomes much harder for her to stay off of it and relapse back into. So in that situation, you may have to advise that both she and the partner be going to de-addiction, right? You have to look at this global picture
Yes. Yes.
when it comes to treating a patient. It's not just one individual you're treating. Secondly, the G2P1 thing which was given. Now, in my
Child
school, yeah,
social service.
yeah, but if you were to ask me, the child I had it as a teenager, and the child was given away for adoption. So they are not living with
Mm,
the child. So, all right. So that doesn't become abuse concern, but you not asking about it would affect your information gathering. So you see how the marking is. Okay, it is written in a very it's an easy task. Was it anything difficult? But yet there are things which are clues given inside your task, in the write up of the task itself, which you should grasp on, right? Read it very carefully. Gravida 2 means you needed to ask something about past obstetric is not mentioned here. In these
yes.
situations, of course, future obstetrics, etc., does not have much weightage as such, but it is important to ask if this were a unplanned pregnancy and what contraception, if at all, she was using. Reason being, because often these women will have unplanned pregnancies. Hmm?
Yes. Yes.
Right or wrong?
Yes. Right. Right.
Right.
Yes.
Okay, so they will have unplanned pregnancies, and this may be one of them as well. And now she has decided to continue, that's fine. But for future, contraception would be very, very important, like in terms of patient safety point. All right. Hmm? So from the TOG article, I know that you were trying to remember that table where common health conditions are there and dental, etc., etc. But in a real life situation, if you look at how your task key is going to be there in applied clinical, you'll just have marks for formulation of a management plan for her. Okay, that's it,
Yes.
like telling her the key points in it, and it will not rely too heavily on going into depths of each and every aspect of what is given as a condition in the talk article, but you have to be selective about what she is more likely to have rather. Hmm? So
Yes.
she's a woman who is being beaten up. Also, he does get angry with her, but she's entirely in a dependent situation. So, because of this, she cannot go anywhere or want to complain to the cops. Nothing of that sort is happening with her. She's helpless. She is on substance. Okay. And she occasionally uses heroin, which she mentions, which is a IV drug user. Now, you got the picture what it is like. Also, he uses occasionally alongside with her. So he procures the drug and uses with her. All right. So her other concern, which she has mainly, is with regards to one child that I had was already taken away from me, and is this going to happen again? So that was one of the things. Now, what I do not like when a candidate does something is keep talking about it without checking understanding, without saying yes, whatever, and allowing the role player to ask any questions in between,
Okay. Okay.
right? Because you decided that this is about the TOG article and you went on with it, right? Like at no point of time I was given any sort of like chance to guide or take you in the right direction, was I?
Mm, okay. Okay, ma'am. Yes, I understand this. Okay.
Mhm. That did not happen.
Yes.
So it went on like da, 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 da,
It is
just
not a direct
talking, talking,
scenario,
talking.
ma'am. The Okay, ma'am, it is not direct like about the methadone
It
because
should
already
not
few
be,
people
which is why at the beginning of the task I warned you, please remain open. Don't, fixate on a particular thing. All right. Even if you
okay.
think that you have revised it, please go with an open mind. Try to see what all is there in the task. All right. Opiates, of course, they are there, but that is something that already she has it's spoken for. She's already dealt with it, gone to the de-addiction centers. What is your role at this point of time is to tell her if she uses heroin intermittently, even in between, what are the consequences of the same? And you need to tell her like what will be done, right? So
Yes.
of course, communication point of view, no major red flags as such. You did build a repo, assure confidentiality within safeguarding limits. Like if you see any safeguarding problems, then of course it will trump your confidentiality. But here, you don't really see anything, and she is well within her rights if she says that she doesn't want to report the violence to the cops right now. It's up to her. We don't really have a choice in it, unfortunately, but that is how it works. All right. So non-paternalistic, good body language I could not see because you had your camera off. All right. Information sharing needs to be explained to her, right? That means that when you are telling her about the multidisciplinary involvement, you need to tell her that the notes, etc., will be shared between the plan. Okay,
Mm,
all right,
okay, ma'am.
between the
Yes.
different uh, people who will be comprising of the multidisciplinary team. All right, all the different agencies it may have to be shared with. This is something which you have to explain to the patient, and usually they are happy to go ahead with it, but do not breach it or without telling her, explain to her the need for the sharing of information. That is another vital point in communication in this particular task. Okay, so from patient safety perspective, you will identify that there are some sort of like safeguarding concerns here with regards to the domestic violence which is there, and additionally you will say that your care will be of course in a multidisciplinary input from the community midwife, the obstetric team, okay, then her de-addiction
Clinical
center,
mental health.
directly mental health
Mental
specialists
health.
are not uh, directly, unless you have identified that she is having an issue, because she's already in touch with the addiction team, so they will always be there. Social support will always be there. Okay, community midwife will play a very important role in doing all of these things, but she needs other people involved like independent domestic violence, okay,
Mm,
advisors. So that is more important. IDVA, you were to mention this. All right. So addiction services. All right. IDVA, safeguarding midwives. These will be very important. Mental health SOS becomes to assess whether she requires anything. How will you ask this question in this individual?
which question, ma'am?
About say exploring her mental health, or exploring if she hadn't told you about the use of heroin, how do you explore these things? I'm hoping that you would have explored it.
I can explain to her any woman in pregnancy can actually feel of self harm or other harm, or she can it is actually a distressing condition can put the woman in stress. So did you feel any thought from this thoughts?
Sorry, can you repeat that, please?
I can tell here a woman who is pregnant, she can have some sort due to increasing her stress conditions. She can have a sort of self harm or other harm, or she feel hopeless, or the life is not worsening. So it is. Do you have any thoughts from this thoughts?
No, why such extremes all of a sudden in her? If you know that there is a person with depression who's on, off, or taking intermittently or query antidepressants and things like that, in
Or
that person it's fine to ask,
I can ask here, do you feel any low mood or hopeless in past few weeks,
how
like in
has
your
your
infections?
yes, yes, how your mood has been in the recent past? That is more relevant as a question. If she says, "No, I've been feeling fine, or not been depressed," then it's okay. If she says anything with regards to "I feel low," etc., please explore a bit more in depth of what is the seriousness of that. All right. So ask a screen question first, and then if any screen is positive, then accordingly you will ask the
Ask the
next
further
question.
question.
You will ask about anxiety also the same way. Have you been feeling depression or any unnecessary worrying or anxiety during the pregnancy, which many women might be feeling in your situation? So this is something that you need to explore. Okay, it can be a very direct thing. See, it's all about the way that you are asking it, okay, without being, say, offensive to her. And if you have signposted adequately enough before, so you're asking these questions out of concern for her, that has to be clear to her. As long as that happens, no role player is going to take offense from you, even if you ask if your partner is beating you up, right? But
Mm.
the language which you use, that becomes very important. So you have to say that just we have certain concerns, okay, for women in your situation. We often see that they may be exposed to any sort
Sorry.
of domestic abuse or violence. Are you experiencing any those things? And then also low mood, anxiety, okay,
Mm.
unnecessary worrying, these also may be common. So are you experiencing anything? Please ask this way,
Mm.
explain why you are asking, and carry on. It is not a very difficult thing to do, or you think about it, right?
Yes.
So yes, okay. So, all right. Next, yeah. So, whenever one aspect of complex social factors, please remember other aspects of complex social factors. Explore in depth. Okay. Next
Okay.
is your difficulties with the baby that you mentioned. So, what can happen with, of course, if you are continuing methadone, it is one of the proven therapies to keep you off of heroin, which is much more harmful if used during the pregnancy because the dosages are unpredictable. Often they can be laced with other drugs also. We have to make sure that she's not using anything else, right? So how do you do that? It's something that you need to offer all these women. Okay, you will do a urine toxicology, right? You do
Yeah.
a urine
Yes. Yes.
toxicology. You want to make sure that multi-drug abuse is not ongoing, although she may or may not realize if something else was being used by her. But you need to assure, all right?
Mm. Mm.
So we will do this test, of course, to make sure. But what we would advise is a more, adherent follow-up with the de-addiction team to make sure that you're on the right dose of methadone, so that, and ask her what she's using. She was using 60 milligrams. So ask her, tell her that we will make sure that it is titrated, so you're not relapsing back on heroin, which is a very dangerous drug in pregnancy. I'm not trying to scare you, but then the effects that it can have on you are such and such and such, and the effects it can have on the baby are such and such and such. So this is how we are going to enumerate them, right? We are always going to tell about the effects of what might happen if she continues using of the drug, correct? We are worried
Yes.
about it, yes. So what are the effects? It's mostly for the baby, which is like early labor or the baby's growth getting affected, and sometimes during withdrawal. I'm not trying to scare you, but even fetal death or baby can die inside the womb. Then, as you said, after birth, me separate times, etc., etc. And now, after the birth of the baby, we can see that they have a temporary. okay, effect of the drugs withdrawal, which is called as adaptation syndrome, which can range from very mild to severe, having any sort of like irritability, okay, jitteriness, etc., and any tummy upset, okay, and in severe cases can go up to seizures, but this is not very common, it is rare, okay. So they can have like respiratory distress, high pitch crying, etc. Like I mentioned, that you telling each and every of these things would not be, but you need to cover what are the components of it at least. All right, this I've given in a bit of depth for people who want to really read about it, but you need to mention this much point about it. Okay, so then you go on to what are the safety measures that you will be now offering. All right. So more frequent visits, close monitoring with the multidisciplinary team, monitoring of the ultrasound more frequently as well to see the growth of the baby. Okay. This is how you assure sort of adherence to her follow-ups. All right.
Yes.
Okay. And all right. So if you do not want, if she doesn't want to inform the cops about, now that you know about the domestic violence, what additionally should you explore and should you advise?
I will talk more about her. She has
Mhm.
financial support for the baby.
She
How
said she doesn't have. She told you,
uh,
right? She is financially
yeah,
dependent.
yeah, we
Go
can
on.
offer here also another financial services to support
Mhm.
here.
Mhm.
Although even housing and
You need to like ask at least one question about the severity of the nature of the domestic violence. Like, has he used any weapons, or do you feel safe to
emergency
go?
scheme. The
Yes, yes. Do you
emergency
feel
scheme.
safe? Because that becomes a safeguarding concern. If that were there, again, hidden in the task, it was not there. But if it were, then you would lose something on patient safety because your management entirely would change, right? You would offer her admission or something of this
Admission.
sort for
Admi-
safe confinement and
Yes,
not
admission.
send her home under the circumstance without discussing with your consultant. Okay,
Yes, yes.
so whenever domestic violence, please, whenever depression, please explore severity. Whenever domestic violence, please explore severity. Your advice might change based on that, right? So, this is how information gathering will affect your patient safety. All right, okay, so
Okay.
please be mindful about that. So the reason I'm taking this particular thing today is because many of the tasks we are seeing now are having these sorts of issues. Okay, lots and lots of issues, and they're making minor changes to the scripts based on which many
Yes.
aspects of your management do change. Right, so you have to be very mindful about these
Mm.
things, right? So yes, of course, you have advised all of these things. They were fine, but contraception would form another important patient safety aspect here, and a getaway plan as well to her. Please advise, because she's staying with the violent partner. So she needs to make sure that she can dial 999 in any emergency, and she would be getting in touch with the safeguarding, and additionally, she needs to keep a bag with money and crucial documents, etc. Okay, medical notes and all of that. In a safe house, we will try to keep it available so to get away from the partner. Meanwhile, you advise her to continue using the being on the methadone therapy. Okay, not to try. I had one question for you, which I never got the opportunity to ask, was that,
Yeah.
Doctor, I don't feel that continuing methadone is something safe for my baby. I want to stop. Then what are you going to say to that?
Uh, it is actually it is if you this is a safe medication to take
Mm.
in pregnancy, and if
Mm.
you stop, it will expose you to a harm more than benefit. So actually, I
Mm.
yeah,
Anybody has any like other opinion with regards to this? Yeah, I do agree. Partially, I do agree with you. Nitisha.
Yes, ma'am.
Do you agree,
You can tell
disagree?
her, yeah, you can tell her that stopping this medication could bring back like
Uh-huh.
agitation and craving for heroin. So it is better
Mm.
to continue this. This is a safer drug to continue. And
Mm.
also, if at all we have to stop it, we have to taper the dose over a long period of time and with the specialist opinion before stopping it.
Okay. Yeah, precisely. So you can't use the phrase that this is a safe drug in pregnancy because you know that it has neonatal effects, it has fetal effects also, right? But at the same time, you have to explain the need for it is because it is safer than she going back on or relapsing on heroin, which is likely to happen if she stops the drug. However, there are circumstances where if they wish and they have enough motivation, you may taper it down at a very slow pace, okay? Almost up to 2 to 3 milligrams methadone every 3 to 5 days. So it's a long duration of time over which it will be tapered off. It may, however, if the risk of relapse is higher, it may be deemed safer to continue on the same. And also, we may have to adjust or increase the dose of methadone in the third trimester because of the increased metabolism. This you need not tell her, but it's because of the increased metabolism and the drug rate will reduce, right? During this. The next we come to applied clinical aspects of the thing. So, NAS we have already spoken about adaptation syndrome, and the 32-week pre-birth the MDT conference will be done to decide for her care, which will involve the uh, all of her MDT members, all right, including, if required, mental health specialists. Then, after her, at this point of time, she needs a anesthetic appointment, okay, to discuss about any pain relief options in labor and address difficulties for. It may be difficult to get a uh, IV access for her, right? So she needs to be told about that and to discuss about pain relief options. So if you just mention anesthetic antenatal appointment to discuss pain relief options and access to citing an IV line, that much is enough. Okay, all right. So you need not go into too much depth of each thing, for example. Then more importantly, you cover labor in one line and postnatal becomes very important. Okay, because everything almost is going to shift at the time that she is going to deliver. All right. So here you need to tell her that when she goes in labor, it is advisable to have a hospital birth, and she can opt for a vaginal delivery unless there are other reasons for a cesarean section. And here we will make sure that an early IV access is attained and that she's continued on a good dose of the methadone, same as usual. And we'll usually give you some other pain relief options which are safe, generally preferably epidural, okay, because the opiates may not be used. Your baby will be more continuously monitored throughout labor to look for any heart rate fluctuations in comparison to previous heart rate tracings as well. Okay, so this is one sentence about labor, and then after delivery, we will also make sure that you are very closely monitored to see any signs of increase or decrease effects of methadone. So whether it needs to be tapered or increased, both can happen. Both can happen. All right. So and she'll be closely monitored for developing any sort of signs of depression, etc., which are very common in these individuals. All right. The baby will be observed for at least how much time?
72 hours.
72 hours.
72 hours.
Okay, 72 hours. And to note if there is any signs of adaptation syndrome, as I have discussed before with you. And in these cases, we will, of course, support you for any breastfeeding. We'll encourage that please continue the medications while breastfeeding as well, and known to be quite safe for the baby. We will support for the baby to be fed in a quiet, dim room as well. All right. Hmm? So, and other measures that you can advise are like swaddling the baby and giving lots of skin to skin contact to the baby. okay, in view of the adaptations. When you do take the baby home, please observe the baby, and if there is any red flag signs or worsening of the baby's situation, of the breathing or the sedation or the jitteriness on terms of the baby, then you need to come early. Also, if you get any cravings, okay, and you feel like you're relapsing, then please do come early because that will increase the chance of cot deaths also. Hmm? So this you discuss with her, give her a uh, getaway plan as well, okay, and tell her about contraception to wind up the task, okay, and you have to give her, of course, written information, okay, lots and lots of support, all right, during the pregnancy and even after, all right. Now, if I ask you a concern about, I'm worried social service is going to take my baby away, what is the response to that? Common question asked in this. Dr. Mahmood,
Yes, yes, ma'am.
worried about social services.
We can tell here actually according to assessment if they are feeling safe the baby to be with you social service she will not take the baby without your permission.
Without her permission, no. Without any safeguarding issues, right? So you have to
Yeah,
reassure at the same time, you don't want to sound like very harsh, but you have to be realistic with regards to what may happen. If there is any safeguarding concerns about the child, okay, once the child is born, then you cannot help it. Okay, what will typically be done after the baby is delivered? What will happen?
I think the social service and the safeguarding they will assess the safety
So
about
initially, there is a
the
community midwife who will pay her a visit.
yeah
Okay.
community and health visitor. Yes, they will
So
assess the
they'll
safety
be
for the baby.
visit. Now, what they will do is they will assess and ongoingly also for a prolonged period of time they have health visitors who will be assessing this situation and if there are any safeguarding concerns for anybody involved in that situation. All right. Also, you have employment and support allowances. Okay, which is financial aid for women like these. Okay, and access to work schemes. So they can put them in touch with some vocation, all right, so that they are a little more independent because being in the situation that she's in, all right, you have to be able to help her stand up on her own. So currently the scenario is that she's totally helpless. So even if she wants to maybe get out of a violent relationship, she can't, right? So this is looking at the patient very holistically. Hmm? Okay, so not just about her medical and her pregnancy related, but overall, you have to look at her situation and provide for her. So that's what the task is all about. Hmm? Okay,
Okay,
now I
yes.
can just replace this one with cannabis use. Almost the medical information changes, but pretty much everything else remains the same, right?
Ma'am, I have question here. Here I have, I think the talk mentions that if everything go normal, she can deliver with the midwifery unit. Here it is in obstetric
No,
in a
she can
hospital.
deliver with midwifery care, not midwifery unit.
Yeah, midwifery care, yes. Yes.
That is different from delivering in a midwifery unit.
What is the difference? Mean the midwife who will
Meaning,
follow
she
him?
delivers in a hospital, in a
Yeah.
OBS unit, under midwifery care, and not obstetric care. So whenever a concern arises, because
Mhm.
she is going to require continuous CTG, she is at all these complications. Do you think it's safe to wait
No,
for all these complications to arise and
no,
then transfer her?
no, I didn't yeah, understand why they write like this. I was actually confused how midwifery
Okay,
care and she need
okay.
CTG and she need frequent monitoring and epidural, all these things. I
No,
was
no, no.
actually
She can deliver under midwifery care. That is different from delivering. There are midwives in the hospital also.
Oh, okay. Okay.
So she's going to be in hospital, but she can deliver
Under
with the
memory
midwife as
care.
long as, yeah, as long as no other concerns are arising, she can deliver with their care as well. That's what it
Okay.
means. Hmm.
Okay. Okay.
Hmm?
Thank you. Okay. Thank you.
Okay,
Yes.
interesting. All right. So I think that's for today, but I hope that some take-home message has come from the task at least. And any other questions are there? Or should we wind up? When will be next session? So in between the mocks and the classes, we will take other session. Okay, hopefully. Yes,
Thank you,
doctor.
ma'am. It is very helpful. Please give us. Hello, ma'am.
Yes, yes.
Thank you, ma'am. Very helpful. Actually, we need more than for this different scenario and this not direct scenario. We need to know about what can come like hidden agenda or any scenarios that can be different from
Yes,
the recalls. Please. Yes, thank
yes.
you. Thank you.
Okay.
Please, can
Thank
we
you.
have the PDF of the domains?
Sorry, PDF. PDF,
Yes.
PDF unlikely, but you can go through the recording. I can post.
Oh, it will be recorded.
This is recorded. I will try to share. I'll ask the team to share it. Okay.
Thank you so much.
Yeah. Okay.
Can I see quickly the past domains quickly once again?
Sure.
The first.
Alrighty. Okay. Right. Thank you. Thank you so much for the attendance. Lovely to have you.